Hi there, I'm Dr. Gary Simonds of Carilion Clinic Neurosurgery, and I'm going to talk to you today about recovery after spinal surgery. There are many types of spinal surgery, so I'm just going to talk in generals. And let's start mostly with the low back. Let's say you had low back surgery of one form or another. What's the general recovery that's involved with that? Well, the answer is generally to get moving. Believe it or not, the answer is to move, is to get out of bed and start your body moving. It's very dangerous to lie around in bed for too long. You can get pneumonias, you can get blood clots in your legs, and a whole bunch of other complications that can occur. So one of the most important tenets of recovery in spinal surgery is to get moving. That's not always easy. You can be rather sore in the back after surgery. As a matter of fact, there is a certain amount of pain that's going to accompany almost any type of spinal surgery. Often it's a pain of the muscles that run up and down the spine. Those muscles get a little bit mad at you for having had surgery, and they can tighten up or spasm down. And we do have muscle relaxant medicines that can help with that, but basically there's going to be some component of soreness, stiffness, and tightness in the back muscles, almost no matter what you do. Nonetheless, we're going to encourage you to get out of bed and to start moving. Now, the idea is not to go out and dig up the lower 40. It's not to go out and replant the garden or build a wall or move your refrigerator. The idea is simply to move some. It's to walk around and then get some rest. It is also important just simply to seek comfort, to get in a position that is most comfortable for you. Some people are better off lying in bed. Some people are better off sitting in an easy chair. Some people do better with pacing around. Whatever works, whatever helps alleviate the pain is good. But it's important to mix rest with movement. It's important to get up and walk periodically. The first few days after surgery, it may be only a short distance, down a hallway and back a couple of times a day. But we encourage you over time to walk further and further distances, but all the time listening to your body. Don't push it so hard one day that the next day it's almost impossible to get out of bed. For the first few days after surgery, the wound will be an important thing to keep an eye on. And so we want you to make sure that somebody can check the wound and make sure that it's not oozing too much, that it's not leaking. It will ooze a little bit. You will see some old blood on the bandages, but it shouldn't be oozing a tremendous amount and soaking the bandages. As you move more, it may ooze a little bit more, but after about 4 or 5 days, it should seal relatively shut. About 2 days after surgery, you can take a shower. You cannot take a bath, really, for the first several weeks. We usually tell people don't sit in standing water. That means a bath, a hot tub, a pond, a pool, a lake. Don't sit in standing water for any period of time for the first few weeks after surgery, really until you see us in the first post-operative visit. But you can shower. We don't want you scrubbing the wound, but it's okay to let the water run off the wound and make sure it's nice and dry at the end. We don't want you heavy bending, stooping, pushing, shoving, digging, raking. This is not the time to do household chores. It's simply a time to start moving gently, doing a fair amount of walking, and then resting as your body dictates. We can talk about more ways to take care of yourself after surgery in future episodes. Thank you very much for joining me today. Bye-bye now.